Recently, a team from the Guyana Civil Defense Commission was in Cumacao Region 10 to conduct an evaluation. Deputy Director of the CDC, Major Kester Craig, says the evaluation is part of ongoing disaster preparation for communities across the country.
Over the last 2 years, the CDC has been developing a regional disaster risk management system across the country. To date, we have completed 6 regions. Currently, we're working in Region 9 and 10, and the funding for this particular the Region 9 and 10 has been provided by the Caribbean Disaster Emergency Management Agency, CDEMA. So today, CDEMA is accompanying us to do evaluation of the project implementation to see how we're spending the money effectively. And apart from that, we're also doing a site visit in Cumacao area to see the risks and the hazard that is affecting the community. And as you would know, the persons in the residents in Cumacao are usually affected by flooding every May, June, and sometime during December, especially when there's high intensity of rainfall. And that's mainly because of the erosion in this particular area. So we also look at this site, and what's going to happen, this is just part of one of the locations that the team will visit, a team of GIS specialists to highlight some of the high-risk areas. So in developing the risk profile, which is a part of the regional disaster risk management system, you'll be able to see which are the high-risk area. And based on that assessment, risk assessment, and the maps provided, we're able to say, look, this particular area you may need to do additional intervention, so that a little bit more detailed study might be recommended for this intervention.
Regional Democratic Councillor from Cumacao, Dexter Harding, showed the team where the worst of the erosion affects the community. Also part of the evaluation team was Planning and Business Development Manager of the Caribbean Disaster Emergency Management Agency, CDEMA, Andrea Grosvenor, who shares her preliminary assessment of the site visit.
The Civil Defense Commission in Guyana approached the Caribbean Disaster Emergency Management Agency for financial support to the country-directed fund to address the disaster management areas in Region 10. This fund is funded by the European Union, and the project really seeks to develop the disaster risk management plan for the region. But certainly as part of the development of that plan, there will be some risk assessments being done, and you will get a risk profile for the community. We have come to the area of Cumacao because last year there would have been a flood event that would have affected the community, and we wanted to see firsthand the impact of that. And we can see that there's quite a bit of material that comes down through the flooding, which has raised the level of the river, and we are seeing where even now where the original river would have stood, that the banks of the river are being expanded based on the material. We've also seen that where the community have tried through their own means to slow down the water that's coming down the river through placing of like tires or some sort of a bauxite material along the river so it doesn't undermine the road. So there's some efforts by the community that has been done to seek to minimize the impacts. So the project will produce the risk profile, but it is clear that based on what the project seeks to do, that planning for the community will begin, but there needs to be a much more comprehensive study of what is coming down, you know, the areas in which it is, the areas from which it's being moved, and you know the sort of material that is being moved. And we recognize that the May-June is an area that has been identified where there could be some potential flooding, and obviously we want to be very responsive to that. So based on the assessment that the CDC will do, we will now have to examine opportunities for an additional funding. It could be either through the country-directed fund, it could be also through funds the European Union would have also been able to put into the funds at other organizations like the Caribbean Development Bank, etc.
SEDEMA is investing 60,000 euros towards the development of the Regional Disaster Risk Management Plan for Region 10 and Region 9. Major Craig explains that interventions are created for high-risk areas as part of the risk management plan.
One of the intervention that we normally do, especially when we highlight the high-risk areas, is what we call a community-based disaster risk management system. So we have the regional disaster risk management system, but for communities that are classified as high risk, we do a community-based system, which entails coming and do a more detailed risk assessment, looking at the vulnerabilities, looking at the capacity, look at the hazard affecting the particular community, and work with the community in a consultative process to identify the hazard and develop a system. One of the systems that we do is set up a committee, what's called a community-based disaster risk management committee for the particular area. And another system we put in place is we develop what's called a community emergency response team. We train that team in first aid, in disaster response, in relief, in damage assessment, so that they can now help themselves. Another critical area we try to do, especially remote location, is to have early warning systems established. So you don't want to wait till the water level reaches a certain height, then to start responding when people are already significantly affected. You want to have a trigger mechanism so that they could make contact with the relevant authorities long before something happens. They could contact the RDC, they could contact the CDC, and we can now respond to them and help them to alleviate some of the suffering that they would occur as a result of the impact of flooding in the area. And with that system now, we test it and ensure that all the key players within the regions is aware of their roles and responsibility, and they can help themselves.
Major Craigs add that determining if a community is high risk is dependent on a scientific process.
The process is not subjective. So it's a very objective where we use a scientific methodology, and we gather data based on past occurrences and also based on projection if something will happen, on past impacts in terms of impacts to the community, impact to the business in the community, health impact, other physical impact, environmental impact. So when you run through the assessment, if that rank high, then definitely we'll come back here. So I don't want to say now that we're going to come back in this community, but based on what we're seeing, it's likely that this might be one of the high-risk areas, based on the information that we receive.
Overall, the CDC has created disaster risk management plans for 6 regions.
So we've completed for Region 1, we completed for Region 2, Region 3, Region 5, Region 6, and Region 7. So those are the 6. And so we have 9 and 10 that we're doing presently, and by the end of the year we should finish 8 and 4.